topics that I do kind of come to me from what is around with our clients in seeking integrity and what I hear from my friends and what I'm feeling. And so what I'm hearing a lot of this week is anxiety. And I want to talk a little bit about anxiety, kind of what it is, where it comes from, and more importantly, what we can do about it when we're feeling it. So I think that anxiety and addiction and recovery is a really important topic that's just always relevant. So I wanted to start just my little basic definition of fear versus anxiety. And I think fear is a really important emotion. We're talking about this in group today, how fear is a really important indicator that we need to have. We want to acknowledge it. It helps us. Like any feeling, we want to experience and let it go. And it's when it gets kind of trapped into that cycle of not really, no action taken, no release, that kind of when it starts to spin into anxiety. With anxiety, I don't think it's nearly as productive. Anxiety is quite crippling. It can kind of overtake us. It becomes a closed loop of rumination that we kind of spin around in. And it can be really quite harmful. The interesting thing about anxiety, and maybe it's because it becomes so commonplace in certain people's lives, but oftentimes we don't feel it or experience it until we experience it physically. Usually there's a system, something that shows up, a symptom. Maybe our stomachs get tight or our throat gets tight, or just usually, and this is true with many feelings, our bodies kind of have the first tip off. I'm often aware, because I'm pretty tuned into where I experience different feelings now, and they often show up in my body a few seconds before they show up in my consciousness. So it's important to kind of pay attention to that and the physical symptoms. But basically, addiction is a quick remedy to disconnect from all the uncomfortable experiences of anxiety and other feelings as well. And so that's the direct relationship here, is that our addiction, whatever it is, whatever they are, is really kind of a maladaptive coping mechanism to deal with those feelings. And anxiety is one that we often try to avoid and really comes crashing back. So what is anxiety? It's a medley of things. It's thoughts, it's feelings, it's behaviors. All of those things can make up anxiety. So it's really kind of multidimensional in that sense. We know that thoughts perpetuate feelings, right? Thoughts kind of inform the feelings that we experience, and that the behavior response in addiction follows from those feelings. And so really basic cognitive behavioral therapy talks about controlling our thoughts and understanding our thoughts to kind of change the outcome. There's other things we can do as well, and I'm going to talk about those in a moment. What happens if somebody is anxious, especially in early withdrawal, early recovery? It may not always be experiencing anxiety. Oftentimes, that anxiety gets translated into things like irritability, preoccupation, being apprehensive about everything. So just it's a way of being. We know that a couple roots of anxiety are an excessive need for control. I think that's true of a lot of addicts. We feel quite uncomfortable unless we kind of feel things are in control. And I believe that goes back to a safety issue from way back when we were often had trauma or what we call an adverse childhood experience. We learned how to kind of protect ourselves, sometimes in unhealthy ways. And so it's this need for control that obviously the lesson of life, I think, is there are so many things we can't control that we try to. And I think that's part of that is the knowledge of knowing how to discern that. It can be ignoring physical and psychological signs. There's something about anxiety that's almost like an altered state. It's a preoccupied space that kind of closes off other possibilities. And when we get really ramped up in our anxiety, it's really gets more and more difficult to see exit doors and solutions to get out of it. We kind of work ourselves up to the point where just one solution will be, we think, will be the solution, one answer, and we can't ever get there, and we're stuck. And so that need for awareness is really important, and that kind of lessens as we get into anxiety. There's a need for approval. I think a lot of addicts really want that validation. A lot of people in general probably want that validation, but addicts kind of seek it sometimes in what I would call an unhealthy way. And so I think that causes anxiety too. If we can't get the validation we need, if we can't get our needs met, and we know that those unmet emotional needs are a real consistent piece for addiction as well. Here's a big one, perfectionism. That's another thing that a lot of addicts have, and this also I think stems in many ways from our early childhoods where perhaps it was not safe to make a mistake. Maybe we got shamed or bullied or hit or told we were stupid or whatever. And so I think this all leads to a kind of a compensatory defense mechanism, which is, okay, I'll do everything perfectly. I'll never make a mistake. And of course, that doesn't work because to make a mistake is to be human, as the expression goes. And so I think anxiety can result from that as well. We can't get everything perfect. We're going to get punished or shamed or humiliated or whatever it may be. So that's another cycle that kind of feeds that. And finally, something we've talked about here a lot, that negative self-talk, that inner chatter that just won't shut up, that's so critical. And very often we can identify the voice of the person whose voice it is, maybe a critical parent or a teacher or who knows what, but from our past. Sometimes it's just a mix, but what survives in a very strong way is that negative tone and the undermining aspect of it, like telling ourselves, we'll never succeed in anything, or how stupid we are, or what an idiot we are. All this stuff, that's automatic. And that also generates a lot of anxiety. So my point here is that anxiety can result from many of these different addictive processes. And I think that's why it's so common that when people get really stressed. So what do we do with this anxiety? One thing I think, first of all, is just to what I would call center ourselves or ground ourselves, or another term would be to resource ourselves, meaning we learn skills on how to take care of ourselves. And so they can be very simple, like just breathing, deep breathing for 3 or 4 cycles, or some of them are formulaic breathing exercises like 4-7-8 breathing, where you inhale for 4, hold for 7, exhale for 8. All those kind of physiologically temper the body and help it come down. So that's one thing. Grounding, other ways of grounding, really breathing. Scott's talked about looking down at his feet sometimes to stay in the present. You just really, I sometimes picture grounding cords going onto the earth, kind of really anchor me in. Whatever visuals work for you. And they can be really highly developed sometimes in meditation practice. I think another thing besides breathing is really that what I mentioned just now, staying in the present. I think it's easy because of kind of the wreckage of our addiction, especially in early recovery, to get stuck in the past, mistakes we made, things we should have done, things we did poorly, regrets, remorse, and there's the future, the what ifs, what's going to happen, what about all the consequences of addiction? There's usually financial worries and relationship worries and legal worries, and there's all kinds of stuff that causes a lot of anxiety. And so these are very real concerns, and it's I guess, natural to fall into some anxiety about it. But I think what I would suggest from the very beginning of the talk then is feel the fear and understand that fear is a guide to you. It's something to take, it's a cue to take action or to do something with that. And I think the problem with anxiety is, as I said before, we just kind of spin around without really being able to take much action to solve the problem. So don't get stuck thinking about the past or present, bottom line. And then the serenity prayer, right? To recognize what we can control and what we can't, and to really use that as a guide to discern where we need to place our action and where we need to sit tight and work on acceptance. And that's a huge thing too. And then a couple other things. Being so self-critical, I think that's another thing that goes with addiction, but that almost inherent ability to really be harsh with ourselves, cruel with ourselves even, in our judgments, and that's things we've learned how to do. But I think having compassion and kindness for ourselves, along with other people, of course, would be really helpful. And then finally, relaxation exercises, I think, are really important. Progressive relaxation, sometimes that can go with the breathing. So there's many different techniques that can be used. For more serious anxiety, there's psychotherapy always. Cognitive behavioral therapy is very effective. Other kinds of therapies are very effective. If the anxiety is stemming from trauma, then trauma therapy is probably indicated and is also very effective. What you want to do, I think, is avoid the easy fix, which is often medication. So we see a lot of people coming in with benzodiazepine addiction. That's Valium, Xanax, Klonopin, that family of stuff that they're meant to be used in the acute phase of anxiety, meaning short term, a couple days, tops. But we see people prescribing them for weeks and kind of open prescriptions, which is really dangerous because those drugs are highly difficult to get off. It's a very long detox, has to be very carefully controlled with the risk of seizures and other things. So I always urge people to try breathing, to try relaxation, to try a hot bath, to try taking action, to try talking about it, connecting with people, all those things. And then if that doesn't work, I think to really think about medication as an adjunct to therapy. And the anxiety meds, there are some that are non-mood altering, not as many as there are antidepressants, unfortunately. But there are some options out there, but I don't think that should be our first choice, just because I think the hallmark of addiction is to seek for a solution from an external source, right? If we're gonna get something else to fix me. And I think it's always wiser to start ourselves. So I'll shut up there, I talk too much. So anyway, thanks, Scott.
Thank you, David. Thank you for mentioning that meds should always be, I think psych med should always be an adjunct to therapy. Yeah. Any psych med should always be an adjunct to therapy. And I don't think I'm crossing a line to say that, am I?
No, I think if you look at all and we forget this sometimes, even the classic antidepressants like the SSRIs that are so common, they've been approved with therapy. Therapy is always an adjunct. And we know from research that when you combine meds and therapy, the outcome is better than meds by themselves.
Yeah, and and if addiction is in there, therapy plus 12-step plus, Yeah. I suffer from anxiety. It can be crippling for me. I always describe it as, fear is reality based. Anxiety is projection, is pure projection. It's living in the wreckage of the future. The potential wreckage of my future. I can go from 0 to homeless in about 3 seconds flat, and then I get stuck there. And you mentioned, you don't see the way out, and it hasn't even happened, and I can't see the way out of it. And it's like seeing disaster around every corner. It's when the anxiety really kicks in. And some mornings I wake up and I'm really stuck in anxiety, and I can't function, and I have to do some breath work. I do the 5, 4, 3, 2, 1, which I don't think you mentioned, but 5 things I see, 4 things I hear, 3 things I touch, 2 things I taste, 1 thing I smell, or just engage all 5 senses, or and I do where are my feet. I learned this from a friend. He said, look down and say, where are my feet? And ground yourself. You do the tendrils or the roots or whatever. There's so many things I now know to do, but it took me years to learn a lot of these coping techniques. And it took me even more years to learn how and when to implement them.
That's right.
Because I could just spin out of control. I have a question. Is anxiety nature or nurture? Is it hereditary, or is it environmental, or is it both?
No, I think it's both. I think because there's a physiological basis to anxiety. It's just kind of fear that gets kind of trapped, usually because of our minds. But I think people, and when I say nature, I think some people are more prone to an anxious response. Now, that's really hard. I mean, it's impossible probably to figure out, okay, is that really learned, or were they always that way? But I think there's a portion of it that's nature. I think the bulk of it is learned, nurtured, just like shame and other kinds of really troubling and sometimes crippling emotions. They're taught to us, so we learn how to do those. And it's not even a conscious process. It's automatic as we're growing up. And so I think, it becomes a pattern. I've noticed in myself and with a lot of clients that if there's an anxiety issue, there's a really high potential that there's one of the parents has an anxiety issue as well. So I think it's a coping style that's learned from the parents in many ways. And also probably contributing would be a lack of kind of problem solving skills as well. Like self-efficacy and feeling empowered to do something about it, or just kind of sitting there and being stuck. So I think it's both, but I think probably the emphasis would be on the learned or the nurtured part for sure.
Yeah. And I'm glad you mentioned shame too, because I don't think shame is the cause of all anxiety, but I think shame is the cause of a lot of anxiety. You know, this belief that I'm unworthy, I'm not good enough, I'm unlovable, I'm defective. If people know the real me, they will immediately judge me for it. Um, you know, this is again the wreckage of the future. You know, I don't know what people, you know, how they're going to respond if they know the real me, but my brain tells me
Yeah,
that it's going to be disaster.
right. And I think there's a couple things going on there. One is that we have this, as addicts, we usually feel so bad about ourselves for a long time. We create this sort of false self, right? A shell around us that gets the validation from the world and interacts with the world. But inside, even if that part of us on the outside, the public facing part of us gets a lot of validation and compliments, if it doesn't match how we're feeling inside, it's not believable. And so it doesn't mean anything.
Yeah. Yeah,
Yeah.
well, you know, I was talking about this with the guys. We were talking actually about shame and negative core beliefs last night in the level 2 work group that I do for men, recovering from sex addiction. And we were talking about, you know, the empty calories of a pat on the back versus the fulfilling, wholesome meal of actually changing how we believe, what we think about ourselves, you know, and changing our core beliefs, working on our core beliefs. It's an inside job. You know, the outside stuff certainly helps,
Right.
but you know, it's affirming ourselves. It's reality checking. It's all kinds of things to get over this. And you know, and I find that the same things work with my anxiety that work with my shame. It's reality checking and affirmations and you know, just you know, is this thing I'm afraid of likely to happen? You know, in my head, it's going to happen. But if I ask someone who's not caught up in it, they're like, "Are you kidding me?" You know.
Right.
Um, so yeah, anxiety, it's just not rational. I've been called into the boss's office and he said, close the door, close the door. And I'm like, oh my God, I'm getting fired. That's my first thought.
Right.
And he's not firing me. He wanted to ask my advice about something.
Right.
You know, I got this problem. I don't know how to deal with, you know, I was like, oh, this is the opposite of getting fired.
Exactly.
But I was terrified, you know, just because it's the negative self-talk, whatever it is. So anyway, we've got a lot of questions and I need to shut up. So type your questions into the Q&A feature or the chat feature, but I go to the Q&A feature first, and we'll try to get to everybody. Okay, this first one, essentially, I have finally come out to my wife, but I did trickle truth her over probably 2 weeks. It is not my finest moment, and we are working through things slowly. It's only been about 8 days since she knows the whole truth. She knows everything about me going to escorts, how I paid, that some were transgendered, etc. But for some reason, when she asked if I had performed anything on these people, I lied and said no. And I don't think if I tell her this truth now, she will forgive me. Can I still recover with just this one tiny truth that she does not know? I'm working with a therapist. I'm doing other 12-step programs, etc. More meetings almost daily.
You know, this is a fairly common situation where there's a little holding back of something. I think of lots of clients who kind of spilled everything, and it's not because they didn't remember. They certainly remembered an event, but they thought that was sort of so horrible that if somebody knew about that, it would be the ultimate betrayal, somehow worse than the others, or a deal breaker of some kind. My feeling is that any little seed like that of a lie, which is what it is going to be harmful. That's you are going to know it's there, even if she never finds out. You're going to know it's there. That's a rip in your integrity, it's a tear, and I think that is the potential for shame and anxiety and feeling bad about yourself and ultimately relapse. And I think it's hard. This is not an easy thing, but I think what we have to do is be honest and let the chips fall where they may. And it may be that that's a deal breaker, and it may not. And nobody can predict how that's going to be. But what I can predict is that if you hold back on certain things, it's going to cause a lot of problems for everybody down the road. So I really encourage you to make it right, get some therapeutic support. I don't think it sounds like you've got a formal disclosure. It's too soon, and this kind of all trickled out. But I think formal disclosure process, which is guided by therapists and takes time, a lot of preparation, I think that would be the place to do this in the context in which revealing this would be most helpful.
Yeah. So let's say this individual and his wife get a couples therapist who's a CSAT and is going to guide them through formal therapeutic disclosure, which isn't going to happen for 3 to 6 months. That's pretty much the time frame for that. Should he say, you know what, I didn't tell you everything, but let's schedule a formal therapeutic disclosure so I can get the remaining secrets out? Should he tell her that there's more now, or should he just wait until that formal therapeutic disclosure?
I think that's pretty cruel to throw that out and then not reveal it for 6 months. I think very often wives assume there's more there. And I think it's far better to say, we'll deal with all this in the disclosure process, where there's plenty of support, there's opportunity for going back and forth. And yeah, that would be what I would recommend.
Sure. Okay. Yeah. Okay. Thank you. Many addicts experience shame. Can repeated affirmations heal the shame? Are there scientific studies proving the effectiveness of affirmations? What other recovery tools help reduce shame? Great question.
Great question. I would say all addicts experience shame, not just many. Every addict I've met, and I've met quite a few, has a shame core that is.
And all non-addicts also experience shame.
Right. I guess the human condition, shame is a real powerful companion to addiction, and it's often the root of a lot of these feelings. So I think that, yeah, so many do experience. Affirmations are a great way to do it. I think we were talking earlier about negative self-talk and these negative core beliefs, and in many ways through experiences, what we call adverse experiences, which could be abuse, whether it's sexual or physical, emotional, or verbal. It can be neglect. It can be a parental divorce, a mental illness in the family. I mean, all kinds of things can result in a kind of an unusual family of origin that can cause problems and cause shame for someone about that. And that once that pattern gets established, it grows. And so by the time I think somebody comes to a place like seeking integrity, a lot of people have shame about feeling shame, right? It's compounded and grows, and we witness people dropping in what we call a shame spiral, which is where they just kind of the shame overtakes them. I mean, much the way that anxiety overtakes people, and that's really not a very productive place to be. It's actually quite a hurtful and harmful place. So it's something to be kind of talked about, avoided, and I think affirmations can help that to some extent. I think the most powerful, like the gold standard of really healing shame, is to bring it out into the daylight. And there's nothing more powerful and liberating for a person and the people around him or her when they express something they're afraid to express. That and we were just talking about this in group today, almost everybody had said they had at least one secret they promised they would take with them to the grave, right? Because it was too horrible for anybody to ever hear. And we have a process in group where we talk about secrets, past or present, and give them away, if you will, to the group. And somebody had a big one today, a really big one. And they said it. And the group was beautiful, as it always is. The people respond. It makes us relatable. If we are perfect, perfection is not very lovable. If someone's vulnerable, if somebody has flaws, if somebody's a human being with feelings, and that's much more relatable. And so I'll just share, it was a very powerful group. We do this, not the first time, but it's powerful. If somebody does something like that, we have each member of the group make eye contact with that person. The person that told the secret makes eye contact, and the witness, the other people in the group, the therapist asks that person, are you judging this person? Do you have judgment about this person? And inevitably they say no. but it's so affirming for the person who's just revealed that secret to have this strong connection and acceptance. It's huge. So that's a very long way of saying, I think the best thing you can do for shame is to get rid of it. So to leave it behind somewhere in a safe way, of course. But
yeah, Brene Brown talks about shame a lot. And, she says shame thrives in the darkness and it withers in the sunlight. When we get it out into the open and shine a light on it, as long as we do that with empathetic, non-judgmental people, it kills the shame. And and it really does. Addicts, sex addicts, we basically have two really good chances to get our shame out. One of them is formal therapeutic disclosure, which we just talked about. And the other one that all addicts have, whether you're a sex addict or not, is step 4 and 5, the searching and fearless moral inventory that we then, in step 5, share with God, ourselves, and another human being. And my personal experience with step 5, sharing it, is probably the most powerful thing I've done in terms of reintegrating myself with humanity, in terms of feeling like a person who belongs to be with other people. And, shame was keeping me isolated and alone and afraid of people. And, I did kind of a group 5th step. I had 4 or 5 really good friends in recovery, and they didn't know everything. They knew most of the stuff. So I sat them down one day and said, listen, guys, I just want you to know everything. And I told them everything, and I was like, oh, I just ruined my whole circle of friends. And they were like, okay, let's go to lunch. Where do you want to eat? That was the response. They're like, thanks for sharing. That's cool. And they shared some of their own stuff, and then we all went to lunch. And we're much closer now than we ever were. And I don't carry that shame around. I don't feel like I have a secret that I'm carrying around from important people anymore. I don't spew everything to everyone. But the safe people in my life and the people I care about, they need to know everything. That's how I am. And because I don't want to carry that shame around. This next one, this is a good question for David. Does Wellbutrin reduce meth cravings for chemsex addicts?
Great question. So, like with amphetamines, we've been looking for some kind of medication that will help reduce cravings. And we've been really frustrated in that. There's been stuff for opioids for quite a while. Last year, there's been some promising research. Mirtazapine, which is Remeron, old atypical antidepressant, has been shown for mild users. But just about 2 months ago, in the Journal of the American Medical Association, JAMA, there was an article on a really promising combination of drugs that seems to be very, very effective for meth. And it is Wellbutrin, is one of them. But it's not the form we normally take. It's Wellbutrin that's injected once every 3 weeks. It's a long-acting Wellbutrin combined with naltrexone. And if you're familiar with opioids and alcohol, naltrexone is a drug that reduces some of that and can reduce cravings and really helpful. And so they found combining those two things. And it's interesting. Wellbutrin has been, people have been curious about that for years because it works with dopamine, and methamphetamine works with dopamine, and it just seemed kind of common sense that it would be effective, but it wasn't really by itself. But when they've combined with naltrexone, and these are both now, they'd be considered off-label uses of these drugs. It's not an approved protocol, but in research, formal research written up in JAMA, they say this is getting to be effective. I'm seeing more and more meth clients on this protocol already, just by their doctors are doing it. I've had a couple that said it really significantly reduced their cravings. So I think there's great promise here.
But these are not permanent fixes. These are temporary mechanisms, and then we get titrated down and off.
Right. So, we get into what's called MAT, or medication assisted therapy, with for opioids, for example, there's like a substitution therapy that's been somewhat criticized, although it's been very helpful for the opioid epidemic. But basically, you're taking them off a more dangerous opioid and substituting another that they're going to stay on. And this methamphetamine intervention is not that. It's to help get people through that very rough period of triggers and cravings and impulsivity that's characteristic of methamphetamine.
Yeah, the funny thing about that substitution drug is heroin was invented as a substitution drug for morphine. Turned out to be way more problematic than morphine, but that's how they were originally using it. And mostly it was women who had been prescribed morphine for menstrual cramps who were hooked on morphine. So they were then giving them heroin. So these housewives were all hooked on heroin in the beginning. So
soon to be followed by cocaine, by the way.
yeah,
So.
yeah. So there we go. Just a little drug history for everybody. Does dialectical behavior therapy help in early recovery from sex addiction? Certainly does.
I love these questions. All right. So let me explain DBT, or dialectical behavioral therapy. It's Everybody knows cognitive behavioral therapy. That's kind of the standard psychotherapeutic approach. DBT is a slightly different form of it that was really invented to work with borderline personality disorder. And it has been shown to be very effective for addiction and many other things as well. What I love about DBT is that it's a set of skills, and it includes things like mindfulness training. It includes ways to deal with cravings. It includes ways to manage your moods. So all those kind of skills that we talk about that are so important in early recovery, as we're gradually kind of withdrawing, or not gradually, we're withdrawing our addiction, which we used to cope with all that stuff. And now we're learning new skills to deal with them in a more healthy way. And that's what DBT is really great for. And I think, so yes, in early recovery, it's profound. The only thing I would say about that is that those skills kind of remain with DBT at that kind of skill level. It's not as so much what I call psychodynamic or digging into kind of the roots of the problem. It's really more how to deal with the problem in an everyday situation. So I think DBT combined with more, I guess, insight oriented and trauma and other kinds of deeper psychotherapeutic work would be important. But boy, is it a great set of skills, for sure.
Yeah, and at our treatment center, we use a combination of CBT and DBT and various other therapies. And we sort of start at the beginning of the process of uncovering trauma, but that's usually a longer term thing. Correct me if I'm wrong, David, but I think that's kind of how we approach things.
Yeah. Those skills are really important first, and then kind of feelings awareness, and then to start working on some of the deeper issues like trauma, which usually happens after people have left us, because that really occurs not before the second month, I would say.
Okay, in SMART recovery, they believe that the addict has the power to change her behavior. In 12 steps, powerlessness is central. Which one is more likely to succeed in your opinion? I don't think those are mutually exclusive, but I'm going to let David answer first.
Yeah, interesting question. So SMART recovery, for people who aren't familiar with it, is an alternative, but it also, I think I can go with the 12 steps because I've had clients do both. But it's a facilitated meeting, unlike 12-step fellowships, which are kind of peer-led. You have to become a trained facilitator to run a SMART recovery meeting. It covers all kinds of addictions. It kind of takes out the higher power God language that some people find troubling in the 12-step fellowships. And it really is kind of more up the skills-based formula of kind of like DBT, where there's a lot of cost-benefit analyses of behaviors, looking at cues, looking at responses. It's very kind of practical. And that's where I think you're saying the person in recovery is kind of empowered to take these actions and figure out what they need to do. And it works. I've had clients go to both and benefit from both. I don't think they're mutually exclusive. In 12-step, certainly we say powerlessness over our behavior, but ultimately in 12-step program, the addict also has to take the action and make the steps and do what they need to do to recover. So yeah, we're powerless over our behavior or our drug, but the responsibility still is on us. And I think in that way, it's really a very similar approach to SMART recovery.
Yeah, I think words like powerlessness and surrender in 12-step programs are painfully misinterpreted. I am powerless over the fact that I'm an addict. I surrender to the fact that I'm an addict. Now that I surrendered to the fact that I'm an addict, I can do something about it. I have the power to make the changes I need. That's the powerlessness and surrender we talk about.
The paradox of those words.
Yeah, the paradox of the 12 steps is, I don't really quibble with them, but I wish they maybe wouldn't have used the word powerlessness in the steps, because a lot of people misinterpret it and say, well, I have no control. It's like, no, you have no control over the fact that you are an addict, but you do have a choice about whether you want to be an active addict or a non-using addict, a recovering addict, a healthier addict who's not ruled by the addiction. And that's kind of the principle of smart recovery, but it's also the principle of 12-step recovery. So when I said these aren't mutually exclusive, I don't think they are. I think they're preaching the same thing. Right, ultimately. Almost any good recovery program is preaching the same thing, ultimately. It's just slapping a different label on it. There's 100 different religions out there. They all take us the same place, usually. My personal opinion, I don't mean to offend anybody, but I think the recovery programs are kind of the same way. You're ultimately going to do the same work, however you want to label it. So,
great. Also, I just will say, some people find comfort in having a facilitator as opposed to a peer-led group, just because sometimes the meetings are more predictable. Although you can get a bad facilitator too, I've heard of them. So it's just a different approach.
Yeah, and some people actually find comfort in the fact that nobody's in charge in a 12-step meeting because they rebel against that. So whatever works for you, go for it. I suffer from crippling anxiety too. Isn't interpretation and actions just as important? I've done positive things like go to work and interpret it poorly, and then eventually do poorly at work. Do you recommend humor for anxiety? Interesting stuff in there.
Great comment. Yeah, so I think what I kind of read in your first section there is about kind of reframing and how we approach stuff and look at things and our attitude and beliefs about stuff. And so I think I think what you're saying is that the story we tell ourselves about our behaviors can reinforce the anxiety. And it's kind of how we frame it. It's all those beliefs and core beliefs and actions and worries and all that kind of come together to kind of reinforce it. And so, yeah, I think we can kind of, just like in program, we can start the day over if it's a really crappy day, start the day over at 3 o'clock in the afternoon. But I think we can reframe things too. And what that requires is the ability to be conscious of it. And I think one of the problems with anxiety sometimes is when we're in that kind of space of like reduced bandwidth where we're not quite able to kind of think our way out of it, it's harder to do that reframing piece. But I think it's a really important way to kind of change, just slightly shift perspectives and see if you can find some solutions or a better attitude. And I love what you say about humor, because I believe humor is essential. And to be able to laugh, and lately, for whatever reason, with some friends, we've had some really great laughs. And I'm a little stressed, I guess, with the pandemic and everything. And God, I could feel my whole physiology changing with a really strong laugh. And it was great. And so, yeah, I totally believe in laughter. If you can bring yourself to do it, I think some people get so trapped in the anxiety that's really hard for them to give themselves permission, unless they may be caught by surprise. Something.
Can humor be used as a kind of a deflection mechanism? I remember when I was in therapy, I would say something and then I would sort of giggle, and my therapist would say, "What are you laughing at? That's not funny."
Right. That's a good point, Scott, because I was thinking about the like genuinely humorous stuff. But if we're, it's a very common deflection for people to like make a joke instead of talking about a feeling or talking about the elephant in the room or whatever is there. So yeah, that's a really good reminder for sure. But I think just part of recovery, the essential part of recovery for me is having the ability to experience all these feelings. When I was in my addiction, I had a limited range. My emotional palette was pretty limited. It was pretty drab and unpleasant. And I think in recovery, just by I don't know, loosening up, becoming familiar with myself, accepting myself, not feeling so uptight, getting rid of some shame. I don't, all those things I'm sure contributed, and not having the terrible consequences of an active addiction. I mean, laughter is an important adjunct in all that. And I guess, I didn't mention it before, but I think one of the great, if only temporary, tools or skills to get rid of anxiety is distraction. If we can distract ourselves with stuff enough to kind of focus on something else for a minute, that can work. And I think sometimes I've had days though when I will look at like old, like on the Comedy Channel, or look at stupid videos on YouTube or something. Just, it's a distraction, but it also it's kind of a mood changer in a simplistic way. But that's not a solution, but I think it gives us a respite from that intensity of the anxiety.
Yeah, there are days where I wake up and I'm really, really stuck in it. And, and I'll do my breathing and I'll do my 11th step and I'm still stuck in it. And I sit down at my desk and I try to work and I can't get started. And I'll go outside and I'll pull weeds for 10 minutes. And it just, because it's mindless, I don't have to think, it does, and then I can come back in and work. It's, I think a little distraction and, a semi-healthy distraction. The art.
And I'll thank you for that, Scott, because that's a beautiful grounding technique. I didn't mention this, to go out if you have access to dirt and earth, to really get your hands in it and work and do like reading for 10 minutes is ideal, because it not only you're distracting yourself, but you're really connecting with the earth in a real kind of primal way that's very soothing for people.
Yeah, I strongly agree. Follow-up question on anxiety. I don't recall having any anxiety issues for the first 40 plus years of my life, at least nothing I would ever needed to have labeled as anxiety. Now, however, as the partner of a sex addict, porn addict for 8 years, I've definitely experienced anxiety in other areas of my life beyond betrayal, trauma, and PTSD, like with stressful work situations. I've been working on this in my own recovery. Could the heightened anxiety in other aspects of my life be related to the betrayal trauma?
In short, yes. I think any kind of trauma has the potential to kind of relate and expand to other things, right? So we have that traumatic experience, whatever it is. And when we do trauma therapy, we look at these channels of things, of trauma, that kind of string together. And the beauty of that when you're doing trauma therapy is if you can resolve one or two of those things on that channel, they'll all kind of resolve. But in the same way, if you have an experience of being traumatized with partner trauma based on somebody who's acting out in your life, that trauma will kind of take root and other things will start to attach to that trauma as well. You'll start to have anxiety reactions around other things. It's hypervigilance, it's PTSD. It has that same effect. It's a reactive because you're in that state of kind of low-level anxiety all the time, and so you're reacting sometimes with a startle response, sometimes with just trauma. So yes, it can start to grow, and that's why it really is important to intervene once you're aware of trauma as soon as you can. The best practices in mental health is when somebody has a potentially traumatic experience, is to intervene on them immediately. And there are different protocols in mental health to keep the trauma from taking root. And I think the same thing goes with a kind of more long-lasting trauma, where it starts to affect other things and your other relationships and other ways of doing things and how you perceive yourself. And so I think it all kind of metastasizes and grows. And I think we really need to get a handle on it as soon as possible.
And it's very common for betrayed partners to experience PTSD symptoms. They don't necessarily have PTSD, but they display symptoms of PTSD. The trauma of betrayal is incredibly deep. It's something like 2/3 to 3/4. I can't remember the exact numbers. Steffens and Rennie did the study, and it was shocking, the percentage that really looked like they had PTSD, whether they actually did or not.
Yeah, not to get into the weeds, the only criteria that's often not met for PTSD is, do you have to believe your life is in danger?
Right. Yeah, it's the life-threatening criteria.
Right.
The rest of them are usually right on the money.
The rest of them are all there, and sometimes there's that too. but I think, yeah, it doesn't resolve on its own. It just keeps kind of expanding until we do something about it.
Okay, next one here. I know that the opposite of addiction is connection. Yeah, you've been listening. I basically live alone and work alone 23 hours every day. I fight feelings of loneliness and thinking of my family often. What do you feel is the best therapy for those of us who, because of our bad choices, are separated from loved ones and live alone? Great question.
Hard situation. I'm sorry we're going through that. A lot of people are in that. You know, there's been a lot of research past 4 or 5 years on loneliness in this country and this kind of in the world really, but epidemic of loneliness. And this is before COVID. So I think it's a huge issue for a lot of people. And so if it's not possible with, you know, people you love like that, I think you can still work on forming connection. And that's a lot of alone time. Hopefully you're not working all that for 23 hours a day, but I think I would make every effort to connect, and that may be virtual connection right now. Hopefully soon we can all be out in the real world a little bit more. But I think whatever way you can do it, I think that connection is really critical. And there's nothing like it. There's no substitute for it. And then you can get that in meetings, you know, 12-step meetings. You can get it in a therapy group. You can get it in a hobbyist group of some kind. You know, there's ways to do it. I think I mentioned this last week, but I've been kind of craving that connection too. And there's a group of recovering folks up here that are doing, you know, going on kayak groups. And so we're outside, it's safe and it's fun, and we're doing it together. So I think anything like that you can do together. I was talking to clients today about, you know, sex addicts and porn addicts and chemsex addicts are usually kind of intensity junkies overall. And so we're talking about like extreme sports and how a lot of people are drawn to that. But what I would recommend is, okay, be careful about it because you can get addicted to that too. But if you're going to do something, do it with somebody else. Don't do an isolated sport. You know, even those kind of things, just to be conscious of, could I do something and have, you know, a companion or a partner or whatever to help me get through it. So, I mean, this is a situation, I know this is the reality of a lot of people, hours of loneliness. And loneliness is not something to be taken lightly. You know, there's a lot of suicide rates going up right now, especially of middle-aged white men, epidemic of suicide. So yeah, be cautious, but I would really try to look at your structure and your week and see if there's not pockets where you can maybe plug in more interaction with people.
Yeah, you know, I live alone, I work from home. You know, I have cats. It helps. And even with the pandemic, I make sure I reach out to friends and or family. I mean, it sounds like you might be a little disconnected from the family, but you know, just somebody, usually somebody in recovery for, you know, at least a few minutes just to socialize, beyond going to a 12-step meeting, beyond, you know, just doing recovery work, just to hang out. And when it's, you know, we can go to in-person meetings. Where I live, we do a lot of fellowship, which means we go out to usually dinner. I go to the 5:30 meeting every night. We go out to dinner almost every night. There's a group of people that will go. And at least 2 or 3 times a week, I make sure I go out to dinner with that batch of people who are now, you know, close friends after almost 20 years of this.
Right.
But, you know, it's hard, and addicts talk about the 1,000-pound phone, you know, picking up the phone and calling somebody and asking them to do something. It's really hard, but, you know, but then we sit here and we lament when our own phone doesn't ring. We'd love for somebody to call us. Well, maybe somebody else would love for us to call them. So, but it's hard. And it really takes some effort on our part. You know, friendships don't just happen. We have to put a little energy into it. And not everybody we reach out to is going to be receptive, or not everybody we reach out to is ultimately going to be somebody we really want to hang out with. But eventually we'll find our crowd, and I encourage you to just take baby steps and find your crowd. And if you like animals, get a pet, big time.
Sure.
I'm in a therapeutic separation from my wife and family. How do I safely work on connecting with them while not breaking the therapeutic separation boundary?
Okay. So therapeutic separations normally are just what they say. It's a kind of a timeout for a couple that has very clear kind of therapeutic goals, and they're usually highly structured in terms of how that couple is going to move forward to take advantage of this space apart to heal. And so I would think that that separation boundary agreement would include some ways you can interact with them in a productive way. Um, I would check, I assume this is being kind of monitored by a therapist. I'd check with the therapist on how to do this, because I'm not sure what boundaries were laid out. You want to be really careful about honoring that and respecting those. But the whole idea of a therapeutic separation is to really work toward healing. It's not just time apart and then come back together. So hopefully you're working toward improving the relationship now. But I think I have to kind of refer you back to the therapist and the boundary issues and the specifics of the agreement, because they do vary.
Yeah. I love this next question. Does depression after a meth relapse or any relapse last permanently? Or is it a temporary phase that does not require an antidepressant? Great question.
Great question. And as Scott said, every addict, I think, after acting out, has a kind of certainly a remorse and heavy depression phase. That is really a result of the behavior, right? I think when we look at antidepressant medication, it's really designed for a biochemical imbalance that is causing the depression. This is not caused by a biochemical imbalance, except from the addiction, but it will resolve when that mood gets better, when you move out of that phase of the addiction or into recovery. So I don't think it requires an antidepressant. Meth is probably one of the more extreme ones, just because of the high levels of dopamine involved and the destruction it does to what we call the reward circuitry. The way the brain distributes dopamine gets really damaged for up to a couple of years. It does heal, but it takes a while. And so I think sometimes in the cases of methamphetamine, because of that duration, which can last up to a year, and the impact that has on relapses and cravings and triggers, sometimes they will recommend an antidepressant for the biochemical changes that the meth has caused. But in most cases, that's not that severe from drugs or behaviors. And so I'd recommend not using antidepressant unless there's other issues going on. Now, there's a lot of co-occurring disorders with addiction, right? We were going over today, about 40% of sex addicts also can be addicted to substances. There's a great amount of, and I don't know the number, Scott, you might, co-occurring mental health disorders and addiction.
It depends on the study. I've seen for co-occurring addictions and mental health, I've seen anywhere from like 17% to like almost 90%. Depends on the study and how they're defining these things.
Right.
But it's high.
It's one of the hardest things for therapists to do, is to figure out when somebody's coming out of an addiction, what's going on. And I've had clients come to me, meth clients, in fact, who were, psychotic on meth, but had been described, diagnosed as schizophrenic or bipolar, and they weren't at all. They were just in their addiction craziness. And so for those kind of heavy duty diagnoses, I really kind of like to wait until things settle from the addiction once they're in recovery. But if you have a pre-existing depressive disorder, then, you might want to think about medication sooner. But again, like we said before, I think medication shouldn't be the first go-to in this situation. I think you want to let yourself get through those phases and get settled and start to get anchored and programmed.
Yeah. I think you and I both think that as a nation, we are painfully over-medicated. Yeah. So, and another medication question I'm on. Well, Butrin and naltrexone for food addiction. It really does work for cravings. Would it work for sex addiction too?
Interesting. So good for you, first of all. There have been some studies looking at naltrexone for sex addiction. And it seems to be somewhat effective. That work is not as developed even as the meth work right now. So it's just kind of ideas and talk. But I think we're going to see more of that. And then there's some other antidepressants that are sometimes used for impulsivity. But I think there's great potential. I really do. I'm not so sure about the Wellbutrin with sex addiction, but we'll see what happens. These things unfold very slowly. It usually starts with patients' own experiences, and then it trickles up to the researchers to see. So, but that's in the works right now. And I'm really excited to hear about that for food addiction. That's great.
What percentage of sex addicts have bipolar, ADHD, or other mental disorders, and does sex addiction heighten them? I think we answered the first part of that question, but does sex addiction heighten other disorders, or vice versa?
Yeah, because when you think about sex addiction, or any addiction really, but sex addiction with all the intensity of it, it can cause a lot of the anxiety we've been talking about tonight. It can cause paranoia, psychosis, depression, mood swings. That weakens people's ability to control their own feelings. So yeah, I think everything gets kind of amped up with sex addiction and things around it. So yeah, I think it's an issue. Now, one of the other differential diagnoses we have to be careful about: people who are bipolar, as you probably know, get manic and sometimes act out sexually. And so that's not a sex addiction. That's bipolar manic phase sexual behavior. And so I think we have to always look at that kind of stuff. Is there some other kind of mood disorder going on here that would better explain the sexual behavior as just an addictive process? So we have to kind of always juggle that. But yes, certainly everything interacts and kind of gets all heightened for sure.
Yeah. Let's take one more real quick here. My general practitioner prescribed both Lexapro and Wellbutrin on a daily basis to help control my emotional swings and depression. Are these appropriate to take together? And what is the likelihood of them helping? I also attend 5 or 6 12-step meetings weekly, so I'm not just relying on medication.
Great. Good for you for the meetings. Those are both really safe and familiar medications. I'm not a doctor, I'm not a prescriber, so I want to make that clear. But I've seen these prescribed together. They work in different ways, so they're not competing with each other, and it can help. I guess the biggest judge I would ask you is if they're helping you. Are they helping with those mood swings, and is it effective? The likelihood varies by individual, but usually the SSRIs particularly are really effective. They're quite good. Plus, combined with the meetings, that's perfect, because we really need that action, not just relying on the meds. So I feel positive about that.
Yeah, and I just want to add that when you're taking particularly psych meds, make sure your doctor knows everything you're taking. And if you have 2 or 3 different doctors and they're each prescribing something, you need to get them all on the same page. David mentioned like Lexapro and Wellbutrin work differently. They're not competing against each other or counteracting. But I've seen so many people and they're taking meds that are literally fighting each other. And of course they're crazy because the meds are making them crazy. And they get away from the medication and detox off of everything for 3 or 6 months. And then you can actually do a proper psych eval and find out what's going on. But until then, they're just driven by competing meds that are making them nuts.
It's called polypharmacy. It's a huge problem in the elderly too, because we tend to just add drugs as opposed to looking at them. So I think everybody, especially an addict or no recovery, there's something called a drug reconciliation, where you sit down with a doctor, and usually in the course of getting into recovery, we've gone through a lot of doctors and medications for other problems. And I wanted to be anything but an addict. I'd rather be mentally ill. I think I got antidepressants rather than admit that I was an alcoholic. But I think we need to go through, and somebody needs to take it and say, we could get rid of this one or that one, do this, as opposed to just constantly adding, because that really does complicate everything.
Yeah. Excellent. Great questions today, everybody. Thank you. Thank you, David, for being here. What a great topic. Clearly, we rang a bell. So we'll be back next week. We'll see you then. And anything to take us out, David?
Don't be anxious. I'm great at it. A very long day.
Advice.
Okay.
Good night, everybody.